This is clavicle, also known as collarbone. So, how to determine the side of this clavicle, whether it is of right side or left side. So for side determination of this clavicle, this sternal articular end, which is quadrangular in cross section, should lie medially, whereas this acromial articular end, which is flat in cross section, should lie laterally, whereas the superior surface of this clavicle is flat and inferior surface is rough, having grooves, and anterior of medial 2/3 of this clavicle is convex, whereas anteriorly lateral 1/3 it is concave. So this is the clavicle of right side. This clavicle is having two ends. One is medial end, which is also known as sternal articular end, and one is lateral end, which is also known as acromial end. This clavicle is divided into the two parts. One is medial 2/3, which is convex anteriorly, and lateral 1/3, which is concave anteriorly. The medial 2/3 part is quadrangular in cross section, as you can see, whereas lateral 1/3 part is flat in cross section, as you can see. So this medial 2/3 part is having four surfaces, as superior surface, anterior surface, posterior surface, and inferior surface, whereas this lateral 1/3 part is having two surfaces and two borders, as superior surface, inferior surface, and anterior border, posterior border. Now the superior surface of this whole clavicle is smooth, whereas on its inferior aspect there is a rough surface. So here there is one groove known as subclavian groove. There is one groove known as subclavian groove. Near subclavian groove there is one tubercle known as conoid tubercle, and just near to the conoid tubercle there is one ridge-like part, that is trapezoid ridge. So subclavian groove, conoid tubercle, and trapezoid ridge. These three parts are important on the inferior aspect of the clavicle. Now the attachments of this clavicle bone. So on superior surface, medial and anteriorly, there is origin of pectoralis major. On posteriorly there is origin of one muscle known as sternocleidomastoid. Then on lateral aspect, anteriorly there is a origin of one muscle known as deltoid, and posteriorly on lateral aspect, posteriorly, superiorly, there is insertion of one muscle known as trapezius. And on inferior aspect, there is insertion of one muscle in subclavian groove known as subclavius muscle. If you want next video on scapula, then just comment.